going to examine your shoulder, your left shoulder, if that's okay.
Yeah.
So again, it's always very important, like the knee, to expose the patient properly. So we're going to compare like with like. So just having a look to start with, any obvious scars, any wasting, any obvious deformity. And like the knee, we're going to look anteriorly, from the side, and from behind as well. And when I'm doing this, I often examine the spine actually as well with the shoulder, because any problems in the neck can exacerbate or cause shoulder problems. So once we've inspected, we're going to palpate. So Tom, I'm just going to gently feel the bones and the joints around your shoulder. So the first joint is the sternoclavicular joint, which is just here. I'm going to work my way up the clavicle, looking for any tenderness. I feel the acromioclavicular joint, which is often a common source of shoulder pain in the patients I see, especially with osteoarthritis. I'm going to come around and feel the subacromial area. If there's any tenderness here in the anterolateral subacromial space, it's often due to bursitis. So I'm just going to feel around the space, feel the spine, the scapula. Any tenderness there? Good. So now we're going to do some movement. So going to come from behind, nice and relaxing, lift your arm all the way up.
Okay. And so do you know which ones you did without the
I like to come all the way up. And down.
No.
So that's flexion and extension. Good. And again, always compare like with like. So I'd like to do this for me. I'm going to do external rotation. And I do find that external rotation is very good for differentiating between disorders in the glenohumeral joint and problems with shoulder impingement. Internal rotation. So what I'm going to do now, so that was passive movement, I'm going to do active movement. So lift your arm up for me, the other one, up for me, all the way, good. And back the other way.
Perhaps if you show me them.
Can you, you're not quite going ideally. Can you go behind? Keep going. Good. And back as you were. And lift your arm all the way up.